Good afternoon. It's my pleasure to be here, and I'd just like to jump in and piggyback and continue the conversation around STDs. But first, just to share a little bit about BD. We are a global medical technology company that develops, manufactures, and sells medical devices, instrument systems, and reagents. And we're focused on improving drug delivery, enhancing the quality and speed of diagnosing infectious diseases and cancer, as well as advancing research, discovery, and production of new drugs and vaccine. We were founded in 1897, so there are two sales guys, Becton and Dickinson, who met in a train station in Texarkana. And Becton noticed that the sun was shining in Dickinson's eyes, and he went over and lowered the shade. And that was the introduction of the two founders of Becton and Dickinson first came out with a Lure syringe. So now, fast forward a few years later, we're almost 30,000 strong in over 55 countries. So small beginnings, but certainly a large presence today. So continuing with the conversation on STDs, and I'll talk about herpes simplex virus, which it's estimated 1 in 5 people, 5 adults in the U.S. have this. After an initial infection, the virus remains latent in the body, and it can be reactivated by stress, exposure to sun, or compromised immunity. There are 2 major types, HSV1, which tends but is not exclusively oral, and HSV2, which is genital. And the sites infected are skin, lips, oral cavity, eyes, genital tract, and central nervous system. So a very, very common virus. And going back to the pyramid here that Carl had shared, oftentimes these individuals have no or only minimal symptoms, signs or symptoms of the disease. But when the disease occurs, the symptoms are painful itching or tingling lesions, flu-like symptoms, or painful burning during urination. So you think, if 1 in 5 adult Americans have this disease, why is this important? Why is this a public health issue? One reason being it's associated with increase of HIV infection. And as Carl mentioned, you get these diseases that just come together and make women and men more vulnerable to picking up other infections. Also is a cofactor as well in the development of cervical cancer, and there is also a risk of neonatal transmission. There is no cure, but antiviral therapy can reduce the severity and longevity of the symptoms, and this is a lifelong infection that people have to manage through. So that is just a short primer on HSV, and just moving to cervical cancer. One of the areas of focus and interest that we have is really around public education. So I'll just tell I'll tell on myself right now is I've been in the healthcare industry for 30 years now, and it wasn't until I joined Women's Health at BD that I knew HPV was the cause of cervical cancer. And it is such a basic fact that we need to get out there so that women understand that this is something you can screen and it is curable and preventable. So what is cervical cancer? Cervical cancer is caused by a persistent infection of HPV. And what happens through a woman's life, oftentimes, especially in the 20s and early 30s, women have many HPV infections of different genotypes. The key point is that usually within 6 months they resolve, but it's really the persistent infection that leads to the issue. HPV is a group of more than 100 viruses, and as I said, most HPV infections clear themselves. But there are certain high-risk types of HPV viruses that are strongly linked to cancer, including cancer of the cervix. If left undetected and untreated, these high-risk types can cause cancer. So there are technologies today to screen for cervical cancer, the first being the Pap test, which is the one that most women commonly know. I go in for my annual test, a Pap test is done. And basically what that is, taking cells and doing a cytology test to understand if there are any abnormal cells. And today, liquid-based cytology is one of the technologies. So you might have heard the term Pap smear. That's literally taking cells from the cervix and smearing it on the slide. What has happened is with the advancement of technologies with both our companies is liquid-based, a significant advance, liquid-based cytology, which is widely adopted in the U.S., that enables you to collect the cells in a liquid and basically purify and clean it up so it is easier for the cytotech or the pathologist to look at the cells and is able to detect more disease and clean up some samples that otherwise they could not read. The other significant technology here is the HPV test, which uses molecular biology that Carl was referring to as well to check the cervix for HPV. That, again, can cause abnormal cells and cervical cancer. So what is the benefit of regular screening? This is perhaps one of the largest successes in public health in the history in the U.S. Between 1955 and 1992, cervical cancer deaths declined more than 70%. You know, you think, how many cancers can you have that type of impact through a simple screening? And it used to be one of the most common causes of cancer death in American women. So that is a significant change. So why did that happen? In 1943, Dr. George Papanicolaou developed this Pap test, hence Pap, that's where that came from. So Pap test screens for precancerous cancer cells, which can be treated and removed, stopping cervical cancer before it starts. However, with all this great screening, 12,000 women in the U.S. still develop or show up with cervical cancer every year. So here's an example of a slide that you can see and some potential outcomes of reading of the slide. So the first one's called ASCUS. So atypical squamous cell, undetermined significance. So a lot of words, but ASCUS really means ask us, we don't know. Because basically what it says is it's undeterminate and they don't know. So follow-up tests such as HPV or bringing the woman back in 6 to 12 months is very common. L-cell or H-cell, low-grade or high-grade squamous intraepithelial lesions. So that's literally looking at the cells. Is the nucleus large as compared to the cytoplasm? So there's a lot of things that these cytotechs and pathologists look for in these slides to determine whether additional testing, moving on to a biopsy, and ultimately treatment is needed. So certain types of HPV cause cancer. So we said, there's over 100 different HPV viruses, but the trick is it's persistent infection with these high-risk types is what is the direct cause of cervical cancer. So HPV, what are called 16 and 18, are two genotypes which are the most widespread and associated with 70 to 80% of cervical cancer worldwide. So many of the technologies, the HPV tests, some of them today include the ability to test for 16 or 18 because they are higher risk. HPV 6 and HPV 11, just as in contrast as an example, are low risk, and they're more related to causing genital warts. So there are differences in these HPV infections. So I'd mentioned that the burden in the U.S. is that, we are a developed country, and there's a screen that can find cervical cancer, but still 12,000 women show up with invasive cervical cancer. And of these women, most are not screened in the past 3 years. The median age of diagnosis is 48. So this is a woman in very productive years where, oftentimes there's children, they're raising a family, they're earners in their family. And it causes over $300 million annually in medical costs. So overall, screening rates differ by different types of coverage. So private insurance, 82% of women are screened. Within Medicaid, 76% of women. And the uninsured, 65% of women. So what has happened actually this past March are some changes in the guidelines. So this is the USPSTF as well as ACOG as well as ACS have all made revisions. And basically the major change in the recommendations is going from the annual Pap test to a Pap test every 3 years. So the Pap test should start at 21, and women between 21 and 29 should receive a Pap test every 3 years. If there's an abnormality found, then they will test for HPV. Women 30 and older can either continue with just the Pap test every 3 years, or they can do a co-test with both the HPV test as well as the Pap test, and if both are found to be negative, then wait 5 years. So very effective screening guidelines. And women who've had the HPV vaccine should still follow the screening protocol because some of these early vaccines do not, like we said, there's over 100 HPV viruses. Typically, the older vaccines cover 16 and 18, and there are other high-risk HPV tests that can result in cancer. And the incidence and the cancer statistics do also vary by race and ethnicity. So for example, from the incidence perspective, both Hispanic women and Black women have higher rates of incidence, 11.8% and 9.8%. Mortality is highest in Black women. And then finally, if you look at the percent screened, you see there's also quite a bit of variability between the women. In some cases, there may be a financial factor in terms of why some of these women are not getting screened, and you see the resulting incidence and mortality. So even though we've made great progress, there's a lot of work left to be done in the U.S. So cervical cancer is a global epidemic. So globally, it is the second most common form of cancer among women worldwide. And in 2005, over 500,000 new cases were detected. I was at, I would say, my favorite congress that occurs every 2 years, IPV, the International Papillomavirus Congress, so I get to go to these fun congresses. And I spoke to Dr. Ferris, who we work with in terms of some social action in Peru. Peru actually has one of the highest rates of cervical cancer in the world. And what happens here is that through a co-sponsorship, women are brought in, they literally walk 2 to 3 days to get to a site where they can be screened. And he sees women, he walks in and he goes, you know, there's these women who are in their 20s who have invasive cervical cancer and it's too late to do anything. So in the developing markets, it's really 80% of the cervical cancer incidence is in these developing markets, and nearly 300,000 women die of this disease needlessly because it can very easily be screened. So without urgent action, deaths due to cervical cancer are projected to rise almost 25% over the next 10 years. There are a number of public-private partnerships to tackle cervical cancer, one being the Pink Ribbon, Red Ribbon, and that's a public-private partnership to expand screening treatment for women in the PEPFAR-funded countries. So this past March, there was funding extended to Zambia, and I just heard last week also funding extended in Botswana. And there you've got, you know, talk about the interaction of disease, it's HPV and HIV, so they're both a significant issue. And as a business, we provide the training and education for the laboratory staff and healthcare workers to help establish the infrastructure in those countries for screening. And then we collaborate with the National Cancer Coalition to screen and treat the 75,000 women in the remote mountainous region of Cusco, Peru, which is what I mentioned. This is what they call the Cervical initiative. And as I mentioned, so what is so exciting about diagnostics and what diagnostics can do? It can prevent a needless cancer. So in the U.S., screening is covered by the private plans and Medicaid and the Affordable Care Act, so it is covered, yet many people do not know about the importance of screening. So as I mentioned at the very beginning, I did not know the connection between HPV and cervical cancer. And so there are many women that we need to raise the awareness and increase and stimulate their interest in getting screened. The CDC works with states and nonprofits to provide education and free screenings to the uninsured. I know ACS is very involved as well in terms of ensuring that there is funding to provide the screening and education. And I thank you for your time, and I believe I turn it over to Lisa. Thank you.